What are lip filler swelling stages and timelines? I get asked this a lot, both by patients who are going to have the procedure, and certainly we get phone calls after I've done the procedure. I do a lot of lip injections, and patients today demand this. They love big lips. They love voluptuous lips. And so really what patients want to know is, what can they expect afterwards? Usually the procedure involves putting a needle or a cannula in the lip with some trauma to the lip. And the lip has lots of blood vessels. It also has a lot of glands. And the combination of the blood vessels and the glands creates swelling. Trauma creates swelling. And areas that have a lot of blood vessels get more swollen. So what can you expect the day of the procedure? You have some swelling the day of the procedure, but often the day after the procedure, there's a little more swelling. 3 to 5 days afterwards, there's still a little bit of swelling, but the swelling is down, and that's when my patients tend to really like things. I get patients who really get afraid the day of the procedure. They're a little too swollen and they look a little bit unnatural, and a lot of my patients don't want their lips to look unnatural. A few want it to look unnatural, but most want it to look very natural. The day afterwards, they may be a little more afraid because their lip is a little more swollen. But 3 to 5 days afterwards, when they have a little bit of swelling, they usually like this. Then 2 weeks afterwards or so, they often feel like, I'd like a little more. Now, because we're not injecting them as if we're doing this for a party, we have to watch that thing. So there's a curve of how big the lip looks after surgery. It gets its largest in 12 hours to 36 hours afterwards. And then the swelling goes down to about 4 or 5 days, that it's a very small amount of swelling. And then at 2 weeks, they basically have no swelling. So what other things that people want to know? They want to know when their lips look a little bit uneven, and should they call right afterwards? Because swelling is involved, swelling doesn't necessarily happen symmetrically. And so they may get more swelling on one side than on the other side. And because of this, they may notice a little bit of asymmetry or unevenness. I often tell my patients to wait 10 days or so before I would re-see them relating to this. How do you minimize or reduce lip filler swelling? The best way is to minimize it when it happens. And that's partially your injector and partially you. So what can you do? You can stay away from things that make your capillaries fragile and make you bleed more in the tissue. That's the traditional things that we stay away from before surgery. Aspirin, non-steroidal anti-inflammatories such as Motrin, Advil, Metaprin, Nuprin, all of those things. Aleve, Naproxen, all of those. And then the herbal things that make us bleed, like garlic supplements, ginkgo biloba, and there are a variety of them that you can get and receive from your practitioner. If you stay off of them for 10 days, you'll minimize your involvement in the swelling. Afterwards, you will do well if you don't do things with heavy exercise and heavy straining. Don't clean the basement afterwards. Don't go to the gym and lift weights right afterwards. Because even though you'll feel okay to lift weights, it'll increase the blood flow, it'll increase the pressure, and you may get more swelling. Patients often ask me, do lip fillers hurt? And this is a bigger question. I found that when the fillers came out that we were using to put into lips, they were not mixed with lidocaine, and almost all of my patients required topical anesthetic and a dental block, an injectable dental block with anesthesia and lidocaine. Today, I do dental blocks less than 5% of the time because the filler material, the hyaluronic acid, is mixed with lidocaine. And if the practitioner is good and the patient is calm, we can put a little bit in and wait, and that area will be numb, and then we inject for the anesthetized area. So if we do this with a little caution and we can often make this as a not too traumatic and not too painful procedure. When should I contact my doctor after getting lip fillers if there's a problem? Here are the problems that happen. We get asymmetric swelling or a lump or a bump. Lumps or bumps with hyaluronic acid fillers can be dissolved, but I wouldn't think of dissolving them before, at a minimum, 2 weeks after the lip filler, because we don't want to dissolve something that's going to go away with normal time. The other reason that we can get a little bump, if we pull out our lip, we can see these little bumps. And the bumps on the inside of our upper and our lower lip are minor salivary glands. And in putting filler into those areas, we can inflame a minor salivary gland. Those bumps typically go away. And so a little bit of patience usually lets the bump go away and we don't have to use dissolver material. So these are some of the ways to minimize swelling and to let you understand what the normal course is that you will have after you get a lip filler, which is a generally highly satisfactory procedure in most of my patients. Do you have questions about this or anything else? I'd love to help you. You can email me today. I look forward to seeing you, talking to you via email, and seeing you in my office. Thanks a lot for watching.